Southeastern Regional Medical Center Lab operates 24/7. We're open 24 hours a day, 365 days out of the year. We're a full-service laboratory providing services in hematology, chemistry, microbiology, serology, pathology, cytology, blood bank, and the list continues to go on. Our laboratory does 85,000 tests a month. 25% of those tests are on an outpatient basis. Those patients will either come to the laboratory and present themselves to the laboratory where their specimens are collected, or we also offer courier services to our physicians that use our services to pick their specimens up and bring them into the lab. Those specimens are brought back into the lab, analyzed, and results are released both electronically and through a paper trail, depending on what the needs of the physicians are. We have our high-tech information system that we maintain the utmost confidentiality and support in making sure that everybody's lab results are kept confidential, and the only people that know about them is the physician and the patients themselves that the physicians communicate with. During your stay here at Southeastern, there's probably not a visit that you've had here that you haven't had a specimen taken by the laboratory, and that would be by our phlebotomists, who are trained people to specifically collect blood and to handle the blood appropriately, make sure it gets in the appropriate tubes for the various tests that your physician has ordered. Once that specimen has been collected, the phlebotomist will either transport that specimen to the laboratory themselves or use the pneumatic tube system and continue on their morning rounds. Our average turnaround time for our AM labs is 36 minutes. So from the time that your specimen hits the laboratory, it's 36 minutes before a result is available on the average back to the physician to be able to use as he's making his rounds. We have the edge there by being able to provide a better service through communication, through eliminating handoffs, through our high technology laboratory that we have, and also through the expertise that we have in our people that work in the lab and our physicians that work with us in the lab. In our full service laboratory, we do our hematology, which is basically a blood count in your hemoglobin, where the physician can check to see, and a lot of people out there may have heard, getting my iron count checked, and that's what type of testing that we do in hematology. We also do blood chemistries. That's where we actually measure your cholesterol. In our microbiology department, we are currently doing molecular testing for some of the prevalent STDs. One of our newest additions this year is our allergy testing. Allergy disease is on the increase from 25 to 30%, and especially prevalent in young children. One of the unique ideas about our allergy test that we're offering is that it's a one stick. We do it through the blood so that the patient doesn't have to go through a lot of needle sticks to have your conventional skin test done. Because of the sensitivity of our allergy test, we can pick up these allergens in children at a very early age. And if we can pick them up at an early age and treat them early on, then we prevent them from being and leading into more serious allergy disorders in their adult years. Another new test that we offer is liquid-based pap smears, and we have a new technology called ThinPrep. This analyzer will lay a single cell layer on the slide so that it's easier to read and also easier to pick up cell abnormalities, which helps us to identify cancers. During your stay here at Southeastern Regional Medical Center, you may not see many of us in the laboratory. In fact, the only people that you probably will see will be that phlebotomist that shows up in your room in the wee hours of the morning to collect your specimen. But you can rest assured that here at Southeastern Regional Medical Center, we have the utmost trained medical technologists and pathologists in the industry here working on your specimens to ensure that the quality is high, that the turnaround time is fast, and that the accuracy of those results are at a maximum.